Hello, everyone. Thank you so much for joining us today. I'm Chris Essel, President and CEO of Southern California Grantmakers. It's my pleasure to welcome all of you to today's webinar. SCG's mission in response to COVID-19 is to mobilize philanthropy to respond rapidly, effectively, and equitably to this crisis by fostering inclusive collaboration, learning, and bold actions. It is for those reasons that we started this series of funder discussions exactly 8 weeks ago today on March 12th. The world we live in has drastically changed since we first convened 2 months ago with a discussion on how philanthropy can support and enhance the government's response to COVID-19. Since then, members of Philanthropy California have established over 90 local and statewide response funds. These funds provide critical support to businesses, community-based organizations, government agencies, and families. You've also adopted timely strategies to provide immediate help to your grantees and work towards centering equity in your practices. Thank you for what you do today and every day to ensure the well-being of our state. In the coming months, the team at SCG and Philanthropy California look forward to bringing you resources and convenings that will be essential in planning for our recovery from this crisis. As we shift focus from urgent responses to medium and long-term planning, we are so glad to reflect this transition now in a conversation about the impacts on the social safety net. Thank you again for joining us today, and I'll turn it over to SCG's Vice President of Public Policy and Government Relations, Seiran Fu.
Thank you so much, Chris. Good morning, everyone. So before we begin, and as we talk, just as a friendly reminder that all attendees are on mute, and as we talk, please feel free to submit your questions via the chat box. We will get through them as many as possible during the Q&A, and we've set aside generous time for Q&A. At the same time, please also feel free to share resources and links in the chat box, and those will be shared out as well. And so to begin our conversation, I wanted to start with something that I came across this past weekend, which seems so appropriate, and it was T.S. Eliot's Little Gidding, where he wrote, "What we call the beginning is often the end, and to make an end is to make a beginning. The end is where we start from." And it's appropriate because our first speaker kicked us off when we were at the beginning of this crisis. Kathleen Kelly Janus is the Senior Advisor on Social Innovation to Governor Gavin Newsom. She has transformed public-private partnerships between the state and philanthropy with her deep experience as a social entrepreneur, author, and lecturer at Stanford University. We're delighted to have a fantastic partner in the governor's office and to help us get through these times. And we'll start with you, Kathleen, and we'll introduce Graciela Castillo-Krings after you. Kathleen, over to you.
Well, thank you so much, Seiran and Chris and SoCal Grantmakers and Philanthropy California for all of your leadership. It's been such a privilege to work so closely with you over the past year as we've really together invented this role of the first ever Senior Advisor on Social Innovation in the state of California. And I know that this role would not exist without you. So thank you for your partnership. And it is really hard to believe that it was just 8 weeks ago that we were all here together kicking off this webinar series. It feels like 8 years ago. So much has happened since then. And you know, in that moment, I remember reflecting on the fact that we are headed into something really hard and that we're all in this together, and that this is a moment for partnership like never before, because we know that we need philanthropy to be that nimble capital that can address need quickly and to be our eyes and ears on the ground to leading local community-based interventions alongside our statewide response. And it's truly amazing to reflect back on all that we've done together in just 8 weeks. And this is really the first time that I've popped my head up to even think about it or reflect on it, because we've all been so heads down responding to COVID-19. But in the course of our COVID-19 response, Governor Newsom has announced 16 significant public-private partnerships on everything from housing and homelessness to feeding seniors to helping people find jobs. And on a personal note, these last 2 months have been so inspiring for me. I get to be in this really lucky position where people are coming to me every day from the nonprofit sector, from the philanthropic sector, from the business sector, asking, how can we help? What can we do? And while it's far too soon to take a victory lap, we're still in this. This is, we're far from being out of the woods. I do think that I can safely say that California has been a beacon for public-private partnerships in our COVID-19 response, and that we have truly embodied a multi-sector approach in California under Governor Newsom's leadership, and that we've been more effective because of it. So I want to talk a little bit about kind of what the last 8 weeks have looked like and where we've focused our response, and then talk about 3 public-private partnerships that I feel really proud of and am excited to think about how we can leverage this model to as we move forward in the recovery phase. So we are not just fighting a public health crisis, we are also addressing an economic crisis. So, and public-private partnerships have been critical on both of those fronts. So on the public health crisis and addressing COVID-19, public-private partnerships have played a role in everything from supporting our testing and working with private partners to set up community-based testing sites and tracking the spread of COVID-19. We have partnerships with several companies that are helping us aggregate data so that we can actually see in real time where the virus is spreading throughout the state. Public-private partnerships are going to be really critical as we move into this new phase and of addressing contact tracing, and whether that is training a new generation of contact tracers, an army of people who will help us to prevent a second wave of COVID-19, to ensuring that we are doing contact tracing in a way that feels Californian, that feels American, that is not about surveillance and tracking and tracing, particularly in this environment of fear that the federal government has caused for immigrants in our state, but that is about supporting families and creating a healthy environment for our families and making sure that people can stay safe. All the way to making sure that contact tracing and isolation is equitable, and that we are actually making it possible for people to isolate so that we can stop the spread of COVID-19. Because we know that if a single mom is having to choose between putting food on her table for her kids and going to work, or staying home and not getting a paycheck, she's going to go to work every single time. So how do we make it possible for that single mom to stay home and to be in isolation so that we can stop the spread of COVID-19? And then also on the public health response, there's been so much effort around PPE and medical supplies and finding new ways to leverage manufacturing in California, along with the incredible researchers that we have in this state who are doing the important work on therapeutics and vaccines. And one of the things that we're looking at as we enter this new phase is there a role that the state can play, similar to what the Gates Foundation has done, to create a consolidated effort to make that the funding of that research a public-private partnership and actually be really coordinated in where we're spending our dollars. So that's the public health response. A lot of work just in that area, but we're also facing an economic downturn, and families are out of work. People are facing threats of losing their housing. We need to ensure that we are supporting people so that they can weather this storm. And so we've been working on a variety of different fronts to develop public-private partnerships to respond to the effects of the economic downturn as well, whether it is our Project Room Key efforts to support partnerships with motels to house those who are living outdoors, who are particularly vulnerable to COVID-19, and ensuring not just that we're getting them housing, that we're supporting them with services, to food insecurity and making sure that we are finding ways to address particularly food insecurity of seniors who are also particularly vulnerable, to doubling down on a lot of the work that we had been doing long before this crisis began, whether it is working on our master plan for early childhood and ensuring that we are finding ways to particularly make sure that our essential workers have childcare, or ensuring that we are addressing the philanthropic disparities that we know exist in this state, and that our communities in inland California, which we know have less resources philanthropically, are not vulnerable in this moment of need. So lots to do also on the economic front. And as I said, I just want to highlight three examples of public-private partnerships that Governor Newsom has announced over the past few weeks that I think are really exciting and reflect some lessons that I think we can all learn as we move into this next phase of recovery. So first is the Fund for Undocumented Immigrants. 1 in 10 Californians workers is undocumented. 1 in 2 children in our state have an immigrant parent. And so when undocumented immigrants are paying $2.3 billion in taxes in this state, we think it's unconscionable that we are not supporting our residents, many of whom are playing a disproportionate role on the front line of this response, whether it's in as farm workers picking our food or as home care workers, and yet they were not covered in the CARES Relief Act. So we came together with grant makers concerned with immigrants and refugees to say, what can we do? What can we do in the state of California to support cash payments to help people during this time of need? And GSER set out an audacious goal of $50 million to support cash payments throughout the state. And we were able to get $75 million from the state, which will be distributed through the Department of Social Services for a $125 million public-private partnership fund. And what's so exciting about this fund is that it's leveraging the strengths of philanthropy and the state. The state is working with several different NGO partners throughout the regions of California to distribute this cash assistance. These are organizations that are closely connected with communities, but we also know there are so many smaller organizations that are also very trusted in communities and can be that immediate response, but that might not be able to apply for state funding. And the philanthropic capital has also been super nimble and able to get out the door much more quickly than our state dollars to provide that immediate response. So we're continuing to work very closely with GSER to ensure that people get the relief that they need. And I know that GSER is still raising money for their $50 million fund. I think they're up to $20 million now, which is very exciting for anyone who is interested in supporting that effort. Another initiative that we're really excited about in the governor's office is an initiative we launched to bridge the digital divide. We know that 1 in 5 students in California don't have access to technology they need for distance learning, whether it's internet, tablets, or other sorts of hotspots. And students are, as we move to distance learning, falling farther and farther behind. So we worked closely with the Department of Education to reach out to all the superintendents across the state and say, what do your students need? Who are the families that are most vulnerable, and how can we get them support? And so we created a database of all of the different needs across the state, and working with individual donors and companies, we were able to identify 30,000 devices and 200,000 hotspots, and raised $7 million in philanthropy for devices to help bridge that gap. We know it's not enough, and we need to do more, but we're really excited about this initiative, working together with our philanthropic partners and the local school districts to make sure that we're getting as many resources as we can to students in need right now. And finally, yesterday, the governor announced a program that is really near and dear to my heart, the Farm to Family program. We know that food banks are facing unprecedented need, we've heard that the need is up 73% over last year. And meanwhile, farmers are sitting on produce that they cannot sell to restaurants because the restaurants are closed. And so working with the Food Banks Association, we have been partnering on this Farm to Family program to help provide a channel for farmers to pick and donate the food, to pay them to actually be able to pay their workers, and then to deliver it to the 41 food banks across the state in all 58 counties of the state. And so this was a public-private partnership between the Department of Agriculture and our philanthropic partners to transport 21 million pounds of excess produce just in the next month. And that is ensuring that our families who are in need are getting healthy produce for their families, and that our farmers are able to actually use the produce as opposed to sending it into landfill. And we're really excited that Kat Taylor has taken this project on and has agreed to raise the remaining $15 million needed to support the program through the end of the year. So a quick reflection on what these partnerships tell us, and then I want to hear from Graciela as well. It's hard to reflect on this when we're in the middle of the pandemic and everything still feels so much in the weeds. But here are a few initial observations that occurred to me as I was reflecting in preparation for this gathering. First, our partnerships are having an impact, not just in California, but they are providing a model for partnership throughout the country. States all over the country are looking to us in California for leadership, whether it is the ripple effects that have been created by this fund for undocumented immigrants, which is now being replicated in other local jurisdictions, or the Project Room Key initiative, which we launched very early on, leveraging FEMA dollars to support housing people in isolation as opposed to congregate settings. States have been calling us from all over the country saying, how did you do that and how can we do something similar? And so as Governor Newsom likes to say, so goes California, so goes the nation. And I think that this has really never been more true than it is now. I also think that our partnerships reflect innovation at its best. Each of these partnerships is a reflection of thinking about new ways of doing things, using new ways to solve old problems. And as we are facing this major economic downturn, where resources are going to be very scarce, you'll hear about that from Graciela soon, we're going to need this kind of innovative thinking. We're going to be needing to work together to come up with the most creative ideas for how to rebuild our economy. And finally, I think as I reflect on these partnerships, what I feel most proud of is that we are approaching partnership in a way that truly reflects our California values. We hear everybody saying, never let a good crisis go to waste. And, you know, we have this amazing opportunity to address this crisis using the principles that we believe in. And each of these partnerships is a reflection of who we are as Californians, whether it is supporting our undocumented brothers and sisters, even when the federal government will not, or in the tech capital of the world, ensuring that our students are actually equipped with the 21st century technology that they need to learn, or supporting the food system in a way that not just sustains small and medium farmers that make up our California bread basket, but which provides families with healthy options in the way that we all care about in California. We're going to need these California values more than ever as we head into this recovery phase, particularly as we think about how we can reinvent our economy that for so long has left so many people out. How do we rebuild our economy in a way that includes all Californians and that works for all Californians? And that is going to be the challenge that we face over the next several years to come. So in sum, none of us can do this alone. We have to be working together. And I'm heartened by the incredible partnership mindset that we're seeing, because the real truth is that we're going to need it.
Thanks so much, Kathleen. Before we go to Graciela, we did get a question about something you talked about, and this question comes from Mercy Ciodia. My apologies for mispronouncing your last name. And the question is, how is public charge addressed with the fund for undocumented workers that you talked about just now?
Yeah, obviously this was something that was a big priority for us to make sure that we weren't putting folks at risk by putting their name into the system. It is exactly the reason why we have been working very closely with our nonprofit partners to distribute the money. So the state will not have any involvement in the distribution of those dollars. It'll go directly through trusted partners, and there's systems that have been set up to create unique identifications and cash payments so that records are not kept and it is not reflected in state benefits in any way.
Great. Thank you so much, Kathleen. Our next speaker is Graciela Castillo-Krings with Sacramento Advocates, a full-service public affairs and government relations firm. We're actually really proud to also have Graciela represent Southern California grantmakers in Sacramento, so that our interests are represented in the state capitol as well. And she brings 15 years of experience working in the legislature and in the state administration, most recently as the Deputy Legislative Affairs Secretary for Governor Jerry Brown. And so I know when I started in the legislature 10 years ago, 11 years ago, Graciela was leading the way and preparing for what was a very difficult time in that moment. And so Graciela, with the insights you have, could you share with us what you're seeing on the policymaking front? And Kathleen alluded to it, what's ahead and for our social safety net in light of the crisis?
I think everybody knows at this point that we are headed into a recession. Unfortunately, actually, the legislative analyst who was testifying in front of the Senate budget a few weeks ago basically said that California has lost anywhere between 12 to 15% of the jobs it had. That means real people are losing their ability to earn a living, and that is very devastating. Just to kind of give you a little bit of context, going back to the Great Recession, in the fiscal year 2008-2009, the projection when the Governor Schwarzenegger had approved the budget in September was that it was going to be $102 billion for the general fund. Literally about a month and a half later, those projections were revised, and the budget had to be cut by down to 84 billion. That really just started kind of the beginning of the devastation of what was going to happen in a few years. The actual recession lasted between December of 2009. Actually, it ended in December of 2009, but the actual impact to the state budget could actually be seen until 2012, 2013. And in fact, Governor Newsom actually just restored in 2019 some of the actual cuts that had been made in a lot of the social services. That was in 2019, right? So that just kind of gives you a look of what's going to happen. Even though the economy recovers, the actual impact on the state budget has, different budget years that are impacted by it. And so I think we don't fully understand at this point in time how bad things are going to get, especially because the economy has not fully reopened. There's a lot of uncertainty as to what it means to reopen too soon, too quickly, because we need to make sure that we are balancing public safety and public health. But not only that, I mean, if we open too early and people get sick and workers start getting sick and industry has to close, that's only going to exacerbate the situation. So at the end of the day, I think the governor's trying to be as responsible as possible, weighing obviously public safety and the impact on the economy, but trying to do so responsibly. And we don't fully understand, again, right now, we will have a better understanding of what the state budget impact will be once we receive the July 15th tax receipts. At that point, I think that will give us a better understanding of how much we're going to be in pain for the next couple of years. And that's what I just want to be realistic with everybody on the call. We're not just looking at a couple of months. We are looking at the impact that this is going to have on this current budget cycle and on next year's budget cycle as well. And unfortunately, based on what we saw during the Great Recession, a lot of the programs are going to be the safety net programs that government provides. A lot of people that, of our lesser means and are really just making it through day by day, those are the programs that are going to be impacted. We're talking about healthcare to children. I mean, it was such a difficult time being in the legislature during 2008, 2009. You basically had at the subcommittee hearings, people that would come in and basically in tears crying about, do not cut my, my pension, do not cut my food stamps. Basically, at the government at the time had no option but to basically have people decide whether they were going to pay rent, pay for their medication, or pay for food. That's the reality we're going to be facing. And the good thing now, though, all of that said, the good thing moving forward is that the government actually enacted different measures that now put the state in a better situation than it was back during those times. So we actually have about 17.5 billion in reserves. That's great. I mean, that's money that we did not have last time around. Again, it remains to be seen if that's going to be enough to weather the storm or if further actions will be required, such as cuts. But we will know more in the coming months to come. The other thing that is helpful, though, we know what programs have worked, but we also can see areas where philanthropy can really help. The other part obviously will be the immediate crisis right now, but the other big thing will be how do we actually pave the way for an economic recovery? And one of the things I want to highlight, because I think housing has been a big important part of the governor's mission, but also housing has actually been a way of generations being able to create wealth. So let me give you an example where I think philanthropy can really help and play a role by coupling it with not just funding services, but also using some of their funding to advocate for additional changes in public policy. There was a perfect example in Minneapolis, and it was called the Mapping Prejudice Project. And what it became a tool to actually explain how a lot of the zoning laws in Minneapolis and actually in the United States were crafted by racist policies that were enacted at the turn of the century, in the 20th century. And part of that was there used to be racially restricted deeds that became the norm in the first part of the 20th century. That actually, once they became a legal tool, federal government in the 1930s said you needed to have these type of deed restriction in order for you to have financially backed products. That really impacted the ability of minorities to actually own properties in certain areas of not just California, but other parts in the United States. That actually, a lot of these deed restrictions it was basically the impetus for us passing the Fair Housing Act in 1968. However, you can see the decades of actual policy that impacted the ability of a lot of people of color from owning property, acquiring wealth, and being able to actually move ahead and progress. So now the Mapping Prejudice Project actually started to create an entire map, follow all of the deed restrictions in the city of Minneapolis, and actually through that data show that a lot of the zoning restrictions were impacting people of color in Minneapolis. That information then led to passage of different pieces of legislation that changed that. And so in 2018, Minneapolis actually changed the way they do zoning to allow more density in single family zoning areas. So now, and again, it doesn't abolish it. It doesn't say you can't do that anymore. It just allows the option for a developer to go into a single family zoned lot and actually do a triplex, for example. And so in Sacramento, if you walk around, you see this also in San Francisco, you basically have a single family home next to maybe a duplex or a triplex, and it just very easily integrated, and it just allows for higher density. And higher density then is able to provide cheaper housing that people can afford. And so when you look at how philanthropy can help by actually providing funding for research, making sure that that research then informs public policy, that's really helpful. And I think that's where we're going to see a lot of decline in funding, as Kathleen was saying. When the state doesn't have money right now to do a lot of the policies that they were going to enact. For example, continuing to track the progress of Project Roomkey and how it's actually working and how it's keeping people off the streets. So this is where I think philanthropy can fill that gap, because by showing and collecting that data and helping create a repository for this type of data, then that data can inform public policy decisions. It can be really helpful to moving the needle on different conversations. One of the things, for example, in the housing space that we've been dealing with, because a lot of housing decisions have been localized, it's really difficult to understand the implications of some of the policy changes that are being made. For example, when we talk about rents across the state, we don't have a state department that is following and tracking all of the rents throughout the state, right? It would be great if we could say, what is the rent in Eureka versus Humboldt versus Riverside? And then we would actually be able to have that information inform some of these policy decisions, but we don't have that data. We rely on great partners like the Turner Center, right, for that kind of information, because absent the state, we have to rely on these other partners that we trust to provide us that information. Now, the thing with the Turner Center, though, most of their information is more Bay Area centered. So if we could have that type of information across California, and really for us to understand the market impacts and the situation in Riverside, San Diego, Orange County, then we can actually do regionalized approaches to housing and really help actually create effective change and create policy changes that might not necessarily require additional money and programs. While we still need that, but it could actually supplement that and create more long-lasting changes that can just really make an impact on people. We can actually start producing more housing, making sure that the public policy changes that are made are effective and that we can track that effectiveness. And if it's not effective, then let's change them, right? But it's really hard right now to do some of that absent that data. So I think there's an opportunity here for philanthropy to really step in and help us partner up with some of the grantees that they already support, try to figure out what data is needed and help government also achieve the goals that we all want to achieve. So it's going to be a painful, it's a painful situation that we're all headed into, but I am relieved that we're in California, that we have such great progressive minds, and I think together we can make a real dent.
Thanks so much, Graciela and Kathleen. We have questions coming in, and I'll ask them as we go along. And one of the questions I think is, Graciela, you alluded to this, was just in 2009, we were going in with 107, and we left with 84 billion. And so I know we had an opportunity, the 3 or 4 of us had before the call, you were saying that the budget going in this year was $147 billion. And while we're waiting to see what the revenues look like, we're going in with a lot more, and we may be coming out with a lot less. So given that perspective, what does an equity conversation look like when we're talking about budget cuts to our social safety net? And what can, for funders who may not have, for program officers or people who may not have lived through that experience of 2009, what will you be seeing, or what can they expect to potentially see in the direct services and social safety net piece?
Well, based on the projections from the Legislative Analyst Office, we are already looking at a deficit of potentially 35 billion, right? So when you put that into context, if the general fund budget that the governor had actually proposed in January was 147, and we potentially are losing about 35 billion.
Wow.
I think those numbers are jarring, and they also point to the fact that we potentially, even with the reserves, might be facing some cuts. And so some of the things are probably going to be what we saw earlier is, again, some of the services that are provided through Medi-Cal, right? Those are some of the things that went earlier. For example, some of the things that were just put back into place was making sure children have access to optometric services, that they have services to, for example, if they have speech therapy. So certain things like that, right, are going to probably be some of the first programs that go. And then from there, you just keep cutting more and more. The problem is cutting some of those programs then do have impacts on kind of the ability for these children to get ahead and to learn. If children cannot see the chalkboard, or if children cannot hear the teacher, how do we expect them to succeed? So some of the impacts, unfortunately, are going to be long lasting. So those are some of the things I think where we might potentially see some of the services cut.
Kathleen, I mean, when you hear that, and with your partnership hat on, how do you wrestle with that within the equity lens and thinking about the most vulnerable communities affected by these cuts? How do you square that away in that conversation?
Well, you know, I have a one-track mind toward partnership and innovation, so that's exactly where my mind goes. We're going to need to figure out how to do more with less. And that is a discussion that is ripe for innovation. And when we think about innovation, one of the most important criteria is to actually engage communities in the conversation who are affected, right? To take a human-centered approach. And it's something that we've been doing, for example, with our master plan for early childhood. We have a partnership with the Heising-Simons Foundation, the Packard Foundation, and with Silver Giving to support IDEO, a design firm, to come in and to talk with families, particularly low-income families, about what childcare solution would most support their circumstances. And so I think that kind of like outside the box thinking and community engagement is going to be really critical as we try and take an equity lens to addressing the challenges.
And I think when we think about just both what you said, we've been talking a lot about the state. We've been talking a lot about what this looks like, but what does this look like for local governments? I know the city of LA, in Mayor Garcetti's State of the City address, he declared a fiscal emergency and with furloughs of city employees. I mean, what does this look like at the state, not only at the state level, but for local governments? And what can folks who may have nonprofit partners in the direct services side who work with local governments, what's the landscape there with lessons learned from the previous recession? Graciela?
I think we've been talking a lot about the state, and you're right. There's going to be a lot of money that is lost also at the local level, right? You no longer have some of the tax revenue that would be coming in from other sales, and so they're going to be looking really hard as to how to keep just the basic services that they need to offer running. Other than that, I think they're going to have a really hard time sustaining some of that funding without additional help, either from the federal level or the state. But again, it's going to be really difficult when the money's just not there. So Kathleen is right. We're going to have to do a lot less with more. And that is something that I think local governments are trying to work through right now.
You know,
I also don't want to, oh, go ahead, Saran.
No, please, Kathleen, go for it.
Well, I also just want to remind us all also of the important role that business is going to play. And as we think about, and this is, I think, a really important role that the Economic Recovery Task Force is thinking about, is how can we ensure that businesses are playing a role in paying their workers well and making sure that they have the benefits that they need, especially in light of the fact that state benefits may be less available. How are we providing for our workers in a way and developing quality jobs. Our Future of Work Commission is releasing its initial findings tomorrow, and in their work with the Institute for the Future, one of the research studies that they relied upon is a Brookings study that shows that 50% of California jobs are not quality jobs. They're low wage, jobs that maybe it's a good thing if those jobs never come back, you know, and how can we think about rebuilding the economy with jobs that are actually quality jobs that we can train folks for.
And that actually is a really good point, Kathleen, because I think if you look at, even though the economy did recover from the last recession, at the end of the day, the disparity and the inequality gap really widened. And so you have a lot of people that are either underemployed or are employed, but are not necessarily making as much as they need in order to have a high quality lifestyle and to make sure that the next generation is succeeding. So Kathleen is absolutely right. I think this is going to be an opportunity for us to go back and figure out how we actually stimulate this economy and bring back better jobs that actually provide a better living wage that can actually create opportunities for generations moving forward.
I think this directly relates to a question we just received from Diane Helfrey related to this topic is how can we leverage the growth of the sharing economy and individuals stepping up in this crisis to think about innovations and partnerships. So I think you touched a little bit about in your responses, but can you go a little bit deeper given Diane's question?
Yeah, there's a wonderful program that has launched through CARE International that I think is a great example of this. It is CARE, as many of you may know, is a humanitarian organization, an international humanitarian organization. So they have brought together that humanitarian mindset, coupled with partnering with some of these gig companies like Lyft and other delivery companies to bring food to seniors. And they're leveraging the philanthropic partnership to actually pay the delivery workers to put people to work, while also delivering food to vulnerable communities. So I think that's a really creative example of how we can leverage systems that we know are working, help solve multiple problems at the same time, putting people to work, serving people meals who need them. And we can think about that on any number of levels as we try and think about how to leverage those systems to support the humanitarian response as well.
A reminder to folks that you can submit your questions in the chat box. We're getting them and reading them out. The next question we have is from Alyssa Plord about laptops and specifically for the laptops, tablet donations for students. How are they being distributed? And Alyssa asks, this is on a district level. What does this look like?
Yeah, I mean, that's the beauty of the public-private partnership is our Department of Education has direct access to all of the different superintendents of the districts throughout the state of California. And so those devices will be distributed on a need basis directly through the districts, because ultimately the local leaders know who needs the support the most. We don't have that information at the state level, but we're able to collect it, leveraging our leadership at the state level to be able to make sure that those devices get to the place they need it most.
You know, I heard a tension in our conversation because a good tension. I didn't want to suggest tension as a bad thing always, but you know, Graciela, in your comments, you talked about how in 2009, folks were coming before the Senate, but the budget committees with cuts with regard to full scope Medi-Cal, for example, and people were losing a lot of their cash benefits during that time. And we also heard from you that a lot of what we consider, quote, discretionary spending for research centers tends to be the first to go as well, and that philanthropy may have a role there. And so how do you reconcile this tension between this moment where an entire generation of kids won't have access to critical health services, and also a body of evidence that needs to drive policy making will also disappear as well. How does one grapple with these two challenges, given that? And Kathleen, please weigh in as well, because there's this push and pull between the present response and what that long term does as well.
I think it has to be a two-pronged approach, right? And I think there is no one solution for any of this. These are really complex problems, and that they have implications for years to come. And so I think one of the things is we are looking at how to maximize the efficiency and the reach that a lot of the philanthropy dollars are. I'm just saying two things can happen. There's a lot of direct services that philanthropy partners are already doing and helping with, right? They're partnering up and they're stepping up and doing everything they can. But one of the things that I think we also need to consider long-term moving forward is, can some of that funding be then used for advocacy to continue to actually not just have a direct impact today, but what that impact could be in 5 years, in 10 years. And this is where I think some of that partnering up and pushing for policy can help. And what I mean by pushing for policy or advocating for policy is, a lot of the times when you actually have real big significant change in Sacramento, it does not happen overnight. If you look at some of the major policy changes, for example, trying to think, gay marriage, right? It didn't happen overnight. It really was a big education campaign for the public. You have to get the public to get there. You have to, we need to help a lot of courageous elected leaders who have bright ideas and have innovative and progressive thoughts. How do we actually help them to make sure that the public is getting there with them? And a lot of the times, somebody comes up with a wonderful idea in Sacramento, and it's going to take at least a decade before it passes for real significant change, because you can't just expect government to change overnight. And that's part of the democratic process. That's part of it. You have to make sure that people are coming along with you. And I think that's where some of this research and educational campaigns can really start helping change perspectives and mind. And the thing is, a lot of the times, especially right now, I think that is so important, where we have other institutions, again, in the Turner Center, somebody that just comes up to me because I think is so well respected. You have other partners that can help government who have a lot of credibility in their communities. And so when there is, right now, I think we are in a very dangerous times where there's a lot of misinformation, and people are just looking for places and information they can trust. This is where I think a lot of these community organizations can provide that information, and it can be credible and have that credibility that the public craves. So I think it's like two-pronged approach: immediate crisis that is facing our state right now, and then thinking ahead. What is the strategy 5-10 years from now, and how do we get there?
And I think about Senator Mitchell's bill several years ago now that lifted the cap on CalWORKs, for example, and the work that advocates did to make sure that policy was reversed and repealed so that more families could receive more aid when needed. Kathleen, I jumped in there. I apologize. Go for it.
Yeah, well, I think, well, two things. One is that we need to take a data-driven approach to everything that we're doing. If we don't have good data, then we can't adopt policies that are addressing disparities. And no one cares more about data than Governor Newsom. He wrote an entire book about it. And so, whether it is taking a data-driven approach to COVID-19, which we very much have, or addressing the economic crisis, that's going to be really, really critical. I think the other thing we haven't talked about that is important to mention is that, maybe there's not going to be any money at the state level or the local level, and, maybe even philanthropic endowments are going to go down with the stock market, but we can all align to advocate the federal government. And they can print money. So, but in seriousness, there are serious policies that have huge impact on our state. For example, I was on the phone with some leaders talking about housing and homelessness the other day, and we were talking about this opportunity that the governor has presented to actually purchase these Motel 6 chains that to allow for conversion to permanent supportive housing going forward. That's an incredible opportunity that did not exist and would not have existed but for this crisis. And the leaders were reminding me, yes, you can purchase those, but the math doesn't pencil out if we don't have good subsidies. Subsidies are critical. And right now, our Section 8 housing vouchers are in many cases not worth anything in the state of California because our housing prices are so high, and because of the systems that prevent people from actually being able to use them. In many jurisdictions, I've heard numbers as high as 40% of Section 8 housing vouchers go unused. So how do we lobby the federal government to make sure that we're actually getting access even to the dollars that are already allocated to us, that we're actually using them?
For funders interested in what Kathleen just mentioned, we'll share out in our resources Funders Together to End Homelessness, a federal advocacy piece for both public and private foundations, so that for those interested, they can take Kathleen's offer up on that with resources there. Lisa Claire Reale asks, in the past, it was the nonprofit sector that stepped up when a lot of the social safety net programs were cut 10 years ago during the Great Recession. How can the state work with nonprofit leaders across the state as the sector often gets overlooked? And I'm going to turn this over to you, Kathleen.
Yeah, I mean, nonprofits are on the front lines of this response. We need our nonprofits to be strong in order to provide those crucial social services on the ground to communities who need them. And the reality is that nonprofits are themselves under threat right now, both in terms of fundraising. Many of them have had to cancel fundraising events where they rely on those events for their annual revenue. And many of them are facing decrease in grants with endowments in decline from the economic crisis. And so we need to double down and support our nonprofits, because even before this crisis, nonprofits weren't operating with enough resources that they needed to do their work. And so I think there's a lot of opportunities for philanthropy to be strategic in terms of providing flexible dollars, and even for dollars that have already been allocated to programs, being more releasing those restrictions and being more flexible to allow, for example, nonprofits to support the work that they're doing now. And I think this, frankly, I think the state needs to do more, and it's something that I'm working really hard on, because we face this challenge where there are actually statutory restrictions on contracts, but just from a logical standpoint, it doesn't make sense if we have paid a nonprofit to support a convening, and that convening can't take place, that we have to then restrict those dollars. So it's something that we're working on and trying to figure out how we can support nonprofits better.
We have a question from Sean Landry, who asks, how can small cities get equitable access to these funds, especially to support undocumented and mixed status families? Cities have trusted liaisons and partners who can help make the connections for people in need. So I think this might be in relation to the funds that you talked about, Kathleen, with the farm to food banks to and the GSER fund. How can cities get access to some of these opportunities?
So we're partnering with nonprofit partners for the most part, and so happy to share who those nonprofits are. And I think LA County has such a great model of public-private partnership, where there is so much collaboration between cities and counties and nonprofits and philanthropy, and hopefully this will also support that and promote that.
So I think what I'm hearing is that for some of our smaller cities, that there's some work to be done, or let me take a step back. the relationships between nonprofits and their cities is critical to accessing these funds, regardless of the city size. So how for nonprofits who want to engage their cities, that's a critical moment to reflect on those comments. A comment from a question from Roselma Samala. So this I think goes back to the devices, which is in addition to the devices, is the state looking at upgrading the tech infrastructure in the state for affordable and widespread access to networks, Wi-Fi, etc.
For the statewide infrastructure or for the local school districts?
I think this is in relation probably to the comments around schools with the digital divide and access to broadband, Wi-Fi, etc.
Well, I'm not sure if I'm answering the question directly, but what I will say is that there's a lot of layers to this challenge. It's not just about putting devices in the hands of school kids, because ultimately we need to ensure that families and kids know how to use those devices. Although I will say that my 4-year-old, 6-year-old, and 8-year-old know way more about how to use Zoom by now than I do. They show me all sorts of stuff I never knew was possible on Zoom. So kids are pretty adaptable, but it's the parents who need the help. You know, a hotspot isn't going to do any good in rural Humboldt County where there aren't cell towers to actually, you know, allow folks to get access to internet. And so that's another big challenge that we need to address in the state, because we're not going to put people back to school and we're not going to put people back to work, frankly, if we don't get broadband access to the 1 million households in California, millions of people who lack access to basic internet, when our entire economy and, you know, school system right now is being driven by online learning and distance working as well.
So we have 4 minutes left. I just want to read out a comment from Damian O'Farrell, who said, on the subject of supporting nonprofits, one thing that the governor's office can do to support nonprofits in the recovery process is to publicly encourage cities and counties to include them in the planning discussions for the recovery. So that was a comment from Damian O'Farrell. Wrapping up, I'm going to give you 30 seconds on a big topic. Is given where we are, we had conversations about how unsheltered people couldn't be housed, and now with Project Room Key, we're having this conversation. We've talked about decarceration, as that's not possible, and now LA County decarceration, or people incarcerated, have dropped due to the work of many advocates in philanthropy. So for you, what's the big transformation that can happen in this time? What was impossible that can now be possible? 30 seconds each. I will start off with you, Graciela, and then we'll go to Kathleen.
I think housing. This is completely highlighting the need and how important, and it's a social equity issue. And I think there is a willingness for people to come together and try to solve it in a very different way. I feel like it has changed. People are really kind of rolling up their sleeve, understanding the importance of it. And so I'm seeing an opportunity, and I hope we can actually fulfill that.
Kathleen?
Ooh, excited to work with you on that. Housing and jobs. I think, we launched this Future of Work Commission last year with incredible leadership, imagining the future. A Future of Work Commission hadn't been done since 1963, so it was a good time to recalibrate. And we are getting to the opportunity to put some of those recommendations into practice much sooner than we imagined, because we are all going to be rebuilding the economy here, and this is an incredible opportunity to rebuild it in a way that works for all Californians.
Thank you so much, both of you, for your time this morning, for sharing your insights. If we were all together in person, you would have a room full of people applauding you and for your efforts. And thank you, both of you, for your continued work. As we wrap up our hour, I'm just going to share a few announcements about upcoming sessions for all of our attendees. As you heard from Chris, our mission is to mobilize philanthropy, not just our members, to respond inclusively, effectively, and equitably to the pandemic by fostering inclusive collaboration, learning, and bold action. Usually our programs are for members only, but with a fee to participate if you're not already part of Philanthropy California family. But in this crisis, we think it's really important to make opportunities such as these open to all philanthropic partners. So with that in mind, we'll be transitioning these weekly calls to bi-weekly calls in May and June, or I should say bi-monthly calls. And they will still be on the second and fourth Thursday of the month from 9 to 10 a.m. And our conversations will be still organized around a broad theme each week. Please send us your suggestions. We love them, we are responsive to them, and we want to make sure we get to them. Second, starting this Friday morning, we will be partnering with Northern California and San Diego grantmakers as a part of Philanthropy California Alliance on a weekly mindfulness series called Friday Morning Refresh, a 30-minute mental hygiene collective pause. And we hope you'll join us for signing up on our websites at your respective regional organizations, so SCG, NCG, or SDG. And then for those who are not Zoom exhausted and love all of this, we do have a afternoon members social happy hour at 4:30 p.m. and you can look to our website so that we can all be connected. And finally, on this very long list of wonderful events coming up, on May 7th from 10 to 11:30, Philanthropy California and the Trust-Based Philanthropy Project invite you to join us for the third webinar in this series, focused on helping alleviate power balances in the sector at a time when nonprofits and foundations alike are seeking to simplify their practices so more time and energy can be placed on caring for self and community. So with that, it is 10:01. Really hats off to both of you and to all of our members for their continued work. Thank you so much. And until next time, stay healthy, stay safe, and be well.
Thank you.
Thank you.